I'm 25 and started getting under eye bags, and they seem to be getting worse. How can I get rid of them? I started noticing the under eye bags and puffiness a few months ago, and they are only getting worse. What can I do to get rid of them? I hate them and I feel so self-conscious. Please help.
Thank you for your question. You're 25 years old and you have submitted several photos of different tints and lighting that support or illustrate your concern about bags under your eyes, and you want to learn more about what this issue is. Well, to give you some background, I'm a cosmetic oculofacial plastic surgeon, specialized in surgery of the eyelids and the face, practicing in Manhattan and Long Island for over 20 years. If you're not familiar with cosmetic oculofacial plastic surgery, essentially my training was first in eye surgery, and then I specialized in plastic surgery of the eyes and face. I deal with complex as well as straightforward issues related to the eyelids, and certainly bags under the eyes is quite a significant part of my practice. So to learn about what we're dealing with, let's learn a little bit about the anatomy. The eyes sit in a space of the bone called the eye socket, and it's referred to as the orbit. And the fat that cushions the eyes and the structures of the eyes behind the eyes is referred to as orbital fat. This fat is what is pushing forward under the eyes and creates puffiness. It's referred to often in our field as herniated fat. It means this fat is pushed forward or herniated forward, and it's constantly there. Very often people make the natural conclusion that they're tired or they're not getting enough sleep, so they sleep more. They have allergies, they treat the allergies, and very often they also go to their local retailer and look for every under eye cream they can find that's guaranteed to treat under eye puffiness. Much to their frustration, they find that these creams don't work. And that's because the actual issue is not in the skin. It's well behind the skin. The fat that is a physical volume is pushing forward. In a 25-year-old, in my practice, what we generally do is perform a procedure called a lower eyelid blepharoplasty. Now, in some patients, when there is only slight bit of fat moving forward, there is an option of trying to camouflage this through a non-surgical approach, which is an injection using something called hyaluronic acid. Now, this is a material that's very popular, and it's sold under different trade names such as Restylane, Juvederm, Belotero, and it can be of value in camouflaging. But since I can't tell from a three-dimensional perspective with the absence of a physical evaluation, I think I'm going to just try to guide you with the more definitive procedure. Unfortunately, a lot of people try to do this camouflaging approach when the puffiness is too prominent, and that creates more issues such as worsening of the puffiness. When we do this procedure, it is a surgical procedure. It's done under local anesthesia with light IV sedation. That means you get a little bit of a liquid Valium equivalent type of drug that kind of relaxes you, and it's done in our private office surgical facility. This is a facility that is equivalent to the way hospital operating rooms are managed, in terms of safety and emergency processes and protocols, and is certified by the same certifying body called the Joint Commission. We do this procedure, and it basically definitively treats the issue of lower eyelid fat prolapse. We often do a supporting procedure such as the use of platelet-rich plasma. This is derived from your own blood, and it's a concentration of the growth factors that are used for wound healing to help stimulate collagen and improve skin quality and texture. If there's any evidence of sun damage or any issue with the environmental effects on your skin, then platelet-rich plasma has been a very effective technology in regenerative medicine that we've used in conjunction with our lower eyelid surgery. So I think that given this understanding of the issue, you need to move forward with meeting with doctors and learning what your options are. In our practice, it is a very high value to our patients that they recover quickly and have the procedure done in the safest way possible and move on with their lives. I can tell you that in 20 years of practice, puffy bags under the eyes can have such a dramatic impact on a patient's life, because looking tired has a real impact on how you feel and how others treat you. And many of our patients say they're tired of looking tired. So once they have this procedure, it really can have a very nice effect on your life. And any concerns about the surgery and the anesthesia should always be expressed to your doctor so that you feel comfortable moving forward. So I hope that was helpful. I wish you the best of luck, and thank you for your question.